bacterial, that is Gardenia vaginalis, candida, that is fungal, and then the parasite, that is the Trichomonas vaginalis. So now we have to find out which they are talking about. It is the bacterial or parasite or fungal infection. So of 28-year-old woman present to the gynecologist with a complaint of malodorous vaginal discharge. Okay, upon examination, the physician note a thin gray vaginal discharge with no vaginal redness. A whiff test was positive for amine odor, and you know the whiff test positive for amine odor is of this. Let me take you to the Gardenia vaginalis to understand this. So we will go to the Gardenia vaginalis. Mycobacterium tuberculosis, leprosy, Haemophilus, Bordetella, Legionella, syphilis, then Yersinia, lactose, Campylobacter vibrio, spirochete, Lyme disease, syphilis. That's the diagnosis of syphilis and Gardenia vaginalis. So you remember this whiff test, this amine whiff test, that adding QS, 10% QS will enhance this fishy odor is a characteristic feature of the Gardenia vaginalis, and your patient has this gray vaginal discharge which is having the fishy smell. So these all are matching with your bacterial vaginosis, that is Gardenia vaginalis infection. So since they are talking about this Gardenia vaginalis infection, malodorous vaginous discharge, okay, and whiff test positive, so there is a increased amine odor due to after adding 10% of the QoS, and there is a malodorous vaginal discharge. This is a case of Gardenia vaginalis, bacterial vaginosis. Now what their question is asking, which of the following is consistent with this case? So we know Gardenia vaginalis have this characteristic clue cell. When you see the organism, when you see the bacteria, they have been stippled in the your epithelial cell, and it appears as a stipple cell which contains multiple bacteria in that one cell, and it looks like a stipple cell which is called the clue cell. So clue cell is the diagnosis. So clue cell, the vaginal epithelial covered with the Gardenia, has a stipple appearance along the outer margin, and this is the feature of your Gardenia vaginalis. So this will be the answer. Gramineid diplococci, gonorrhea not answer. Colitic cell is not. All I present is the of your say viral infection, and Jank smear against herpes simplex. This is the cytomegalovirus. So we are not talking about the viral. This is the bacterial infection of your vagina, bacterial vaginosis. Okay, let's move one more question, and then we can actually and we can discuss later on. Several postal worker. So postal worker. So they are leading with the post, the letter, come down with the symptoms of dyspnea, cyanosis, hemoptysis, and chest pain. So there is the postal worker. So they are working with the letter in the post office with the letter, and then this is your one of the feature to understand. This is the one of the point. So they are giving you to leads to your diagnosis to identify the bacteria, because anything that is related to the post office is one of the hint to given to you. Then they are saying the symptom of dyspnea, cyanosis, hemoptysis, and chest pain. So this is chest pain, hemoptysis, widening of this extracerebral, the wide mediastinal widening. These all are the feature of one of the anthrax infection. So this is the pulmonary anthrax. They will give you more information on that. So several postal worker come down to the symptom with dyspnea, cyanosis, hemoptysis, and chest pain. Chest extracerebral mediastinal widening. Sputum culture are negative for all routine respiratory pathogen. Serological correctly identify the causative agent. Which of the following structure is possessed by the causable agent? So we are talking about this Bacillus anthracis. So anthrax. So let me go to the gram-positive bacteria, and then we'll discuss this anthrax. We have actually discussed all this thing, but you need to correlate the text, the answer, the written thing that is mentioned in your first aid, and then correlate that question so you can understand. So this is the anthrax. Anthrax has two terms, pulmonary and cutaneous. Pulmonary is inhalation of the spore, must commonly contaminate animal product, although as a potential bioweapon, flu-like symptom that rapidly progress to fever. Pulmonary hemorrhage, mediastinitis, so X-ray, so wide mediastinium, and also called as the Wills-Shorter disease. They can prophylaxis, ciprofloxacin, and doxycycline. They can be diagnosed easily with the serological test. So your diagnosis is obviously the spore. So what is the thing that is related with your anthrax, Bacillus anthracis? They are spore-relating organisms. So the spore is one of your answer, and you hope you have understand this. Thank you over here. Now for the next question we will deal in the next subsequent lecture. Thank you again.